Hello everyone. In a moment, I will perform a liposuction surgery on a patient who is 32 years old, 1 meter 60 centimeters tall, and weighs 52 kilograms. Structurally, our patient actually has a condition we call lipedema. This is in its first stage.
Especially the hips and inner thigh areas are very concentrated and thick. Actually, there is also fat on the front of the legs, but our patient does not want that right now. We will only remove fat from the inner thighs and hip areas. For the procedure, our patient wants general anesthesia to be applied. I also think it will be more logical and comfortable. In the procedure, we will first lay the patient face down to get the body image. Then, by turning over, we aim to achieve the best possible form by also taking from the inner thigh and the upper part of the front of the thigh. Of course, after this procedure, our patient must definitely use a corset. They should use this corset for at least 1 to 1.5 months, and we'll see that those areas gradually reach the shape they should be.
Of course, because of subpatient, we can actually talk about 6 months for it to fully settle after liposuction. It will reach the desired shape within 6 months. During this period, our patient will use the corset and sometimes will need to do massages. We will teach this to our patient after the surgery. They will see in detail what to do in this regard.
The hip area is structurally very large in some people. Our patient is actually thin. In the future, if they gain weight, this area will grow even more and become thicker.
The nature of lipedema is already like this. So if the patient hadn't undergone this procedure, they might have faced a much thicker hip area in the future. Because their weight is low, let's say if they gain 10 kilograms, it will especially increase more in this area. Of course, if they had it done later, since that area would have expanded a lot, it would be more difficult for the skin to recover in that area.
That's why deciding to have this procedure done at an early stage, at a young age, will make it much more comfortable for her. So when we perform this procedure, there is excess skin in that area. However, this excess skin will tighten over time. There is much less gathering in the hips. Then it can bother the patient a bit more aesthetically. I am thinking of bringing it to the best possible shape.
But it should not be forgotten that this is not a lifting surgery. So over time, your hips will tighten as much as possible. This makes you happier because when you sit, you already notice that your hips spread a lot. Or we can say that our patient has a slim waist and abdomen, but because the hip area is particularly thick, it creates a challenging appearance both in clothing and in normal lifestyle.
After the procedure, our patient will be extremely satisfied. Thank you very much. You're welcome.